Frozen shoulder, or adhesive capsulitis, is a condition that causes pain and stiffness in the shoulder joint. Over time, the shoulder becomes increasingly difficult to move, leading to significant limitations in daily activities. The condition typically develops gradually and can last for months or even years. The shoulder is a ball and socket joint that allows a wide range of movement. It is surrounded by a capsule of connective tissue, which helps keep the joint stable. In frozen shoulder, this capsule thickens and tightens, restricting movement and causing pain. The exact cause of frozen shoulder isn't always clear, but there are several known risk factors. People between the ages of 40 and 60 are most commonly affected, with women being more likely to develop the condition than men. Certain conditions like diabetes, thyroid disorders, Parkinson's disease, and heart disease are linked to an increased risk of frozen shoulder. If the shoulder is immobilized for a prolonged period due to injury, surgery, or other conditions, the risk of developing frozen shoulder increases. Some researchers believe that frozen shoulder may be related to an abnormal immune response or chronic inflammation in the joint. Frozen shoulder progresses through 3 distinct stages, each lasting for several months. The freezing stage is the initial phase where pain gradually increases and shoulder movement becomes more restricted. This stage can last anywhere from 6 weeks to 9 months. During the frozen stage, pain may start to subside, but the stiffness remains severe, making it difficult to move the shoulder. This phase can last between 4 to 6 months. The thawing stage is the recovery phase where shoulder movement gradually improves and pain continues to decrease. It can take anywhere from 6 months to 2 years for full recovery. The most common symptoms of frozen shoulder include persistent pain in the shoulder, especially at night, stiffness and difficulty moving the shoulder in different directions, a gradual worsening of symptoms over time, and limited range of motion, making simple tasks like reaching overhead, putting on clothes, or lifting objects difficult. If you experience these symptoms, it's essential to seek medical evaluation for proper diagnosis and treatment. Diagnosing frozen shoulder typically involves a medical history and physical examination. Your doctor will ask about your symptoms and perform a physical examination to assess range of motion and pain levels. While X-rays don't show frozen shoulder directly, they can help rule out other conditions like arthritis. MRI or ultrasound may be used if there's suspicion of other soft tissue involvement. Frozen shoulder can improve on its own over time, but treatment can help reduce pain and speed up recovery. The main treatment options include physical therapy, stretching and mobility exercises that are crucial to maintaining and improving shoulder movement. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage pain and inflammation. Corticosteroid injections can provide temporary relief by reducing inflammation in the joint. Injecting sterile fluid into the shoulder capsule can help stretch the tissue and improve mobility. In some cases, the shoulder is moved forcefully, while the patient is under anesthesia to break up adhesions. In severe cases, arthroscopic surgery may be needed to release the tight capsule and restore movement. If you're dealing with frozen shoulder, there are some home exercises and self-care tips that can help. Pendulum exercises gently swing your arm in circles to loosen up the joint. Shoulder stretching using a towel or resistance band can gradually improve flexibility. Applying a warm compress before exercises can help loosen the muscles. Using ice packs after exercises can help reduce inflammation. Avoid prolonged immobility and maintain good shoulder posture. While some risk factors for frozen shoulder can't be changed, there are steps you can take to lower your risk. Keep your shoulder moving after an injury or surgery. As long as your doctor allows it, perform regular stretching exercises, especially if you have diabetes or other risk factors. Maintain overall joint and muscle health through exercise and good posture. Understanding the complex anatomy of the shoulder joint can help clarify why frozen shoulder occurs. The shoulder joint is one of the most mobile joints in the body, capable of moving in multiple directions due to its ball and socket structure. This wide range of motion is essential for daily activities, such as reaching, lifting, and rotating the arm. However, this mobility also makes the shoulder more susceptible to conditions like frozen shoulder, where movement becomes restricted due to thickening and tightening of the joint capsule. Inflammation is a key component in the development of frozen shoulder. When the capsule becomes inflamed, it triggers a cycle of pain and stiffness, leading to the progressive loss of movement. Over time, adhesions or bands of scar tissue can form within the joint, further restricting mobility. This process can be prolonged and frustrating for patients, as even simple tasks become increasingly difficult. Beyond medical treatment, lifestyle modifications can play a crucial role in managing frozen shoulder. Proper nutrition, including a diet rich in anti-inflammatory foods, may help reduce symptoms. Omega-3 fatty acids found in fish and flaxseed have been shown to have anti-inflammatory properties. Staying hydrated and maintaining overall musculoskeletal health through exercise can also contribute to better joint function. Stress management is another often overlooked aspect of recovery. Chronic pain conditions like frozen shoulder can lead to increased stress and tension, which may exacerbate symptoms. Techniques such as deep breathing, meditation, and gentle yoga can help relax the muscles and promote healing. Ensuring adequate sleep and rest is also vital for the body's ability to recover and repair damaged tissues. Physical therapy remains one of the most effective treatments for frozen shoulder. A physical therapist can design a customized exercise program to target specific movement restrictions and gradually improve range of motion. Consistency is key, as regular stretching and strengthening exercises can make a significant difference over time. Patients are often encouraged to continue their exercises at home to maintain progress between therapy sessions. In severe cases, surgical intervention may be necessary. Arthroscopic surgery is a minimally invasive procedure that involves making small incisions to remove adhesions and release tight structures within the shoulder. While surgery is not always required, it can be an effective solution for patients who do not respond to conservative treatments. Overall, frozen shoulder is a condition that requires patience and persistence. Recovery may take months or even years, but with the right approach, most individuals regain full function and mobility in their shoulder. Seeking medical guidance early, following a structured treatment plan, and incorporating healthy lifestyle habits can all contribute to a successful recovery. Additionally, post-recovery care, ongoing flexibility exercises, and long-term physical activity play a vital role in preventing recurrence and ensuring optimal shoulder health for years to come. Understanding the psychology of chronic pain, adopting a proactive mindset, and engaging in consistent, sustainable rehabilitation can make all the difference in long-term shoulder function and overall quality of life.